Hello, I'm Paula Erica Sanchez, and I'll be presenting on social media's role in the rise of youth suicides. Why would this be considered a public health issue? Two reasons to consider. One being that suicide among young people aged 10 to 19 is on the rise, which means underlying mental health conditions such as depression, anxiety, and suicidal ideation are also on the rise. And two, because it involves an industry that is ever present in our lives, is not fully understood by our government, which has made regulating it more challenging, and operates on a business model that a growing number of psychologists are calling unethical. According to the Centers for Disease Control and Prevention, we've seen drastic increases in both hospitalizations for self harm and, as this graph shows, in successful suicides. As seen in this graph, for both age groups of young girls, 10 to 14 and 15 to 19, we can see a correlation in suicides with the availability of social media on mobile devices, noting the alarming increase in preteens. What's the explanation for this? Well, it has to do with how social media companies have built their businesses. Awareness of the business model of social media companies allows for the public to understand why it's having such a negative impact on our young people. The first is to know that persuasive technology is at the core of their model. Another way to think about it is that the science of psychology, how people behave, think, and feel, is intentionally and methodically built into these technologies to promote longer engagement on them. In August of 2018, 50 psychologists signed a letter to the American Psychological Association accusing psychologists working at tech companies of using hidden manipulation techniques and asked the APA to take an ethical stand on behalf of kids. Why is this important? Because this is all happening in the name of profit and at the expense of the mental, emotional, and physical well-being of young people. Dr. Anna Lemke, medical director of addiction medicine at Stanford, sums it up well in this quote: social media hijacks our evolutionary system that allows us to connect to each other. The first step is being aware of this manipulation for ourselves and especially the young people in our lives. More people from the industry are speaking out, such as the former VP of growth at Facebook, Shamath Palihapitiya, who said in a 2017 interview at Stanford, "We want to psychologically manipulate you as fast as possible and then give you back that dopamine hit. We did this brilliantly at Facebook, Instagram has done it, Twitter has done it, and Snapchat has done it." As well as Tristan Harris, a former Google employee who has become a prominent critic of the way social media operates, quoting, "These technology products are not designed by child psychologists who are trying to protect and nurture children. They were just designing to make these algorithms that were really good at getting you to take a photo with a filter on it." Especially social media starts to dig deeper and deeper down into the brainstem and take over a kid's sense of self-worth and identity. An example of this is a young person deleting a photo on Instagram because it didn't get enough likes or comments. There are many valuable lessons from our country's past when it comes to industries who have directly impacted public health, such as requiring big tobacco to pay for anti-smoking ads. We could use this model to require big tech to pay for ads on social media that warn about the dangers of prolonged use and how people's data is used to manipulate their behavior to generate revenue from advertisers. Regulations would also be needed because we know that self-regulation does not work, especially if it means an industry needs to make changes that would decrease their profits. Also, with regulations, making sure that social media companies or big tech are paying their fair share in taxes so there's public funds to provide resources to young people with mental health conditions and their families. Public service announcements could educate parents and guardians on the impacts to their children, how to unplug themselves so they can be present with their children, and more readily notice signs of depression, anxiety, and suicidal ideation so they can offer support. Another recommendation could be flagging content posted by users to connect viewers of that content to mental health services, much like we saw regarding COVID-19 and 2020 election posts on social media. Lastly, for communities to do their best to get informed about the issue by reading articles and viewing documentaries such as The Social Dilemma that interviews people who have worked in big tech and speak directly to the practices mentioned in this presentation. Thank you for taking the time to view this, and I hope it was informative and helpful.